Joining me now by Skype from Chicago is Dr. Robert Tiballi, an infectious disease specialist and clinical assistant professor of medicine at the University of Illinois College of Medicine. He is also a member of the Catholic Medical Association. Dr. Tiballi, welcome to the show. Great to see you.
Nice to be with you tonight.
Well, as you know, it's now being advised that gatherings be limited to 10 people or less here in the U.S. That's down from the original recommendation of 50 in order to flatten that curve. Can you explain what that means and how it can help to hopefully decrease the spread of the coronavirus?
Well, if I could use a couple of analogies, if you take a sugar cone, an ice cream cone, you flip it upside down, and you would get a cone-like peak. That might be the incidence of unrestricted spread of coronavirus in our population. It would go very high and have a very sharp angle of inclination. If you take a pie tin, flip it upside down, that's really what we're going for here. We're trying to blunt that very peak and make it far less of a high peak, and we're trying not to overwhelm our medical infrastructure. If we have a very high rise and spread of the infection throughout the population, we'll experience much of what happened in northern Italy, where their medical facilities were overrun with sick persons. Most of the people with coronavirus will not become very ill, but they can pass it on to other people. The few people who do need care, once they aggregate in numbers with lots of those few people that do need care, that could overwhelm our intensive care units, overwhelm our ability to care for their special needs with things like respirators and ventilators, and it could cause significant problems backing up, and hospitals could become full, and it would stress the system to breaking point. And as much anxiety as we have in society right now with these changes to our temporal standards and things that we understand and things that we know and things that we do regularly, if we were unable to get medical care when family members needed it, that would be more anxiety provoking than what we're going through right now.
Dr. Tiballi, do you know where we stand here in the U.S. in terms of testing for COVID-19 and also who should be tested?
Well, the testing is being transferred from a public laboratory only to a public-private partnership. That is an evolution everywhere. Here in Illinois, a lot of the testing is still being done through the public health laboratories, which is limiting the availability. One of the things that will open up the avenues to testing very widely is when we develop a blood test for the virus. And while it may not be as rapidly predictive of infection as a swab in the nose would be, it would be readily much more available so that thousands of people could be tested in every center every day, as opposed to just a few hundred persons.
We're also hearing about this shortage of medical supplies. How concerning is that to you?
Well, it's somewhat concerning. We would hope that we would have enough N95 ventilator masks and personal protective equipment for healthcare providers so that they would not get infected. One of the important issues in a widespread infection like this is to protect the medical providers so that they don't become sick. We need our medical providers on the job caring for individuals who are ill.
Well, Dr. Tiballi, thank you so much for joining us. We really appreciate your insight.
Thank you very much.